Now, with that, we just proceed to the next part of this session, which is a panel discussion with dogs who have come out of nowhere and made a positive impact despite all those challenges they have in their life. It's my privilege to please welcome Katrina Singh. She is an Aboriginal Health Liaison Officer at Fairfield Hospital, a proud Wirajudari women from grandmother's side from Narandera, Leeton, New South Wales, Yota, women from her grandfather's side. It's such a privilege to have Katrina here. Please welcome on board, Katrina. Please allow me to introduce Zippy Cohen-Hyams. Zippy is a colleague at the England Institute of Allied Medical Research. She has a great background. She came from Technion in Israel, then she went on to do a postdoc at UCLA. So she brings that interesting perspective where the researchers fill that gap between clinical research and then research translation. Zippy, can you please come here, please? Now, one of our great colleagues I have, I've got a lot of respect for her community engagement and commitment to that cause, Gillian Mason. She is the manager for Hunter Stroke Volunteer Registry in Newcastle. She's Stroke Clinical Trials Manager, Hunter Medical Research Institute, a rehabilitation physiotherapist, Newcastle, a great advocate and champion for stroke. Please give him. Dr. Kathy Wu. Kathy is the head of the St. Vincent Clinical Genomics Program at St. Vincent's Hospital in Sydney. She's leading the Translation Research Centre there. She's also a clinical senior lecturer at the University of Sydney and conjoined senior lecturer at the University of New South Wales. Kathy, please. Associate Professor Rajesh George, who is Director of Centre for Oral Health Outcomes and Research Translation at Southwestern Sydney Local Health District, and Associate Professor of the School of Nursing and Midwifery at Western Sydney University, and Honorary Associate Professor for Faculty of Dentistry at the University of Sydney. Do we have Anya Sali here, please? Anya, it's my privilege to introduce here. Please come on board. Anya is a senior lecturer and senior research fellow and facility manager for Confocal Bioimaging Facility and Office of Deputy Vice Chancellor Research Innovation at Western Sydney University. Anya, welcome on board. Last but not the least, Professor Adiba Kamal Zaman, the Professor of Medicine and Infectious Disease and Dean of Medicine at the University of Malaya, Kuala Lumpur. She's a Director of HIV Research Centre at the University of Malaya, an Associate Professor Adjunct at the ALU School of Medicine. I think you have heard of her before. Thank you very much. Now, before I start this debate, I think the very reason all of you are here, because you all are great champions for the cause and bring that element of diversity, inclusion, intersectionality I've been talking before. Now, my question to you, Katrina, would be that as an Aboriginal health officer and a community member of your community, what is partnership from your perspective? How do you see partnership in your day-to-day work? And whether you've seen a partnership being translated to improving patient outcomes in your community?
Thank you, Dr. Sonu. Partnership to me is many things. Firstly, as an Aboriginal woman, I think there has to be transparency across the board through who we are as Aboriginal people, but coming into hospitals and working with the clinicians and the teams and having an understanding of who we are. Understanding who we are is very important to how we are. Successful partnerships, to me, sorry, I'm getting nervous.
It's a very safe space.
It's really important to have that transparency. Which then leads into respecting the difference in the barriers and challenges that we face as Aboriginal and Torres Strait Islander people coming into hospitals or just health facilities, full stop. So, yeah, what was the other question?
Thank you. Can you just share with us insight from your work that you've seen that partnership has led to possibly an improved outcome in your community, or you've seen that transformation happening, or is it started happening in Adelaide?
So in my space, I am the Aboriginal Liaison Officer, and in that role comes a lot of it brings a lot of responsibility. So we're advocating for our people. We're advocating for better health outcomes. We're advocating for trust. This trust is a really big barrier in the hospitals for us. So what I'm doing personally, because I can't speak for everybody, so what I'm doing personally is, so I am over at Fairfield Hospital, and I did come over from Liverpool, and one of the things I noticed when I got there is there was quite a lack of representation of Aboriginal people, Aboriginal and Torres Strait Islander people, and often I got told that there was no Aboriginal people at Fairfield Hospital. That's not true, obviously. The KPIs prove that. So what I've been doing in the last 2 years now is a number of things to increase representation. I do education sessions around what the ALO, Aboriginal Liaison Officer role is, what that involves, is why we have an Aboriginal Liaison Officer, what we do, how we can connect clinicians, staff members, as well as our patients to community, and just being able to engage with each other in a safe space. So in the education sessions, there's a lot of discussions around cultural safety. It creates a safe space for people to ask questions around what some of the barriers are, or just simply trying to identify patients and around how we can strengthen that, strengthen our patients being identified within our community, so that we're not being told that we actually don't exist in our suburbs. So within the education sessions, we have it's opened up a space where staff are able to ask the questions and are able to ask safe questions and not feel that they're being offensive. Because quite often, one of the feedback that I get as to why people won't ask if that patient is Aboriginal or Torres Strait Islander is that they don't want to offend. But in a health setting, we're asking these questions to close the gap, to educate, to create a safe space. So some of the things we're doing at Fairfield at the moment is one of the education sessions. We just held a big NAIDOC day, and that actually, so 15 months in the making, I've been working in partnership with a number of stakeholders, Angel Feather Foundation being the biggest one, and we've actually just opened an Aboriginal and Torres Strait Islander community garden. Now this is a really big thing for Fairfield. It creates a safe space. It's not only increasing, it's recognising the importance of our Aboriginal and Torres Strait Islander communities in our communities. It's also a space for everybody to go and sit and reflect, because often hospitals are a place where we go for sorrow business, which is just we relate to as trauma, or just, you know, illness, chronic illness. We're also running the first in the district an Aboriginal Falls Prevention Program, which was actually just on SBS World News. So, I mean, at Fairfield, I've really made it my mission to increase representation, increase education, and just make it. So that's the important stuff around building partnerships. Getting in, we've also just created a an executive Aboriginal Health Committee. So what's important when we're working with Aboriginal and Torres Strait Islander communities is involving us in the decision making. because we are experts at our own selves. So it's really important when we're talking about how can we do things better to include us, because the outcomes, just for example, the force prevention group we've been running for 12 months in the making, and we've already made world international news on it because of the impact it's having on the community. We have Aboriginal community, we have elders who would not come out of their homes because it just, you know, and they don't want to go to hospitals because often maybe they've been raised in institutions, maybe they were removed as a young person, maybe there's been incarceration and transgenerational trauma. Because unfortunately, the reality is for our people is that hospitals were a place to either go die or have your children removed. That's our history. However, going forward, working in partnerships with you know, our clinicians and our teams and our staff and our communities, uniting together as one, we have, you know, we have an opportunity to create change and create safe spaces. And I know that this is being mirrored. I work very closely with, you know, Aboriginal liaison officers working across the district, but not only, you know, not only that, with I have the privilege of working with, you know, a number of great teams across the district, and I guess with these partnerships and building these partnerships together, we have the opportunity to mirror, you know, these are just some of the things we're doing at Fairfield. You know, I don't want to take up all the time, so, but yeah, thank you.
Some of the things that I can take from that anecdote is trust, partnership, and closing the gap. That's what you're there. The leadership has led to that building of trust and partnership, and that is transforming stuff. So we're looking forward to that amazing results over the next years. So thank you for that leadership. Now I'll go to Zippy. Zippy had an amazing journey. So you came from Israel, which is often called the innovation hub of the world. It's a melting pot of some of the great innovations. Great IPs come from Israel these days. And then you made journey to US and now in Australia. Now share with me and share with all of us that some of the challenges that you have faced in navigating across different continents, navigating doing biological research at the interface of science, medicine, academia, and you know, it really inspires some of the young and emerging people here to, you know, hear that story and maybe they will take some anecdotes out of it.
Well, I think the main challenge is that you have to start all over again every time you move. So if you move from Israel to the States, and I think, oh, is this the country of camels in the desert? And then you say, no, there's more to that. And you have to prove yourself all over again. And again, coming to Australia, I still hear it. So are you a developed country? Are you riding on camels? You know, years and years after, I said, you know, who invented the flash drive? It was invented in Israel, and other things. So again, for some people or groups, research group, I have to start all over again and prove myself, which is a challenge, but it's motivating. So I think that's the main obstacle. Second, I think it's, again, like any immigrant, different language, different culture, even I think terminology in States and Australia are different. And, you know, so this is not my native language. So you have to learn again what's the terms here, what's the, even understanding people when you work with them in partnership, what they really mean when they work with you. So in the States or here, it's a different culture, different mentality. In Israel, it's a very open society, so we tell in your face what we really think of what she's telling us. some people consider that good, but we are, you know, tell you, this idea is, you know, bluntly, it won't work or it sucks, you know, but you won't say that in the States or even here. So you have to adjust yourself to different societies, culture.
So differences in communication is also a very pivotal aspect of that partnership. So how do we communicate with people from different backgrounds? and whether to be act as a leader or facilitator is key to that problem. Now, why did you make that journey from Israel to US and to Australia? Well, what's the motivation? What was the passion that drove you all the way? You're doing some amazing work that you've done.
I think, as I said, that the challenges, but that also made me a better researcher and a better person. So the aim was not just for me professionally, it's also for my family, my kids. I want them to learn different backgrounds, meet other people, other culture, view. I think it's develop you as a person, make you an open-minded person, and you learn more, and you just have to pick the best from every place you go. And for me, I know definitely developed me professionally and personally. I understood what an immigrant is. Israel is a country of immigrants as well. And I think the only time I understood the immigrants in Israel is when I was myself an immigrant. So I hope, and I think it made me more tolerant and more open to other culture, other view, both professionally and personally.
So I know that you'll be organizing a 3D microscopy workshop in a few days. What motivates you in that learning, giving that even back to the community that you belong? What is the driving factor? The commitment to research and education, so on and so forth.
So first, I think this workshop is a very good opportunity to bring researchers and groups from all over Sydney. So we'll have presenters and people attending from all universities. And I think when you exchange ideas and results, you learn, you see if you are in the right pathway or wrong pathway, or gives you more ideas, or more than that, collaboration. And also, to show the community that we are working for them and be more clear in what we're doing. So we got this, Mari was very successful in founding the microscopy facility, which is million worth, and now we want to show, well, look, we are not less than the top university in Sydney and Monash, and look what we're doing. It's for you, it's for the community, and here's an example of what we achieved in the past few years.
If I could gather from the audience, I think the two important things that Zippy shares is that passion and resilience that is fundamental to her journey. So thank you, Zippy, for sharing that journey. Gillian, you are a great communicator. You are, a star on Twitter, and you are a great advocate for consumers and patients. But more than that, you got integrity. Why I say that? People do communication for, there are many reasons to do communication, but you fundamentally care for the consumers. You want to be involved in their processes from step 1 to step 2, step 3. You want to make sure that engagement is real, is a partnership. Please share some anecdotes from your partnership with your consumers.
I feel like that's a whole lot of pressure going forward. Look, I mean, the reason why I've started being more public and open about what we are even doing in the stroke recovery research space in Newcastle was because I was tasked with a pretty horrible sounding job actually of being the recruitment manager. And that's been, I guess, the culture of how we invite people into our research world, is that we make decisions as academics or clinicians about what health outcomes are important for people, and then we design research, and then we do things to people who we manage to trap and recruit and put through the factory that it can be, and hopefully won't be ongoing, but it can be research. And very quickly, I've been working as a physiotherapist in stroke rehabilitation for a long time, and living with multiple chronic illnesses as well. So have had and have still quite a lot of experience on both sides of the bedside, so to speak. Worked out recently that I've got half as much lived health care experience from that side as I do from a full-time job. But basically, in trying to do this job of recruiting people to trials, it wasn't going to work without finding out why it was that people who was saying to us as clinicians, we want more access to rehab, we want better treatments, we're sick of not being able to have our needs met, they weren't coming to the trial, so why not? And part of it was just that they didn't know about them. So the first thing to do that made a huge impact was just to start openly communicating about the science that was already going on, which just seemed way too simple for me. But surprisingly, when we started, one of the biggest and most impactful things that kick-started this, now what is a community engagement platform rather than a recruitment register, was having a community forum. I was speaking to people who came into trials, and the biggest problem they said was, I would have come in this trial a year ago except I didn't know it existed. And you know, when you have these research seminars at HMRI, it's difficult to get there, or it's at times I can't come. So can't you just come into the community? So we ran a community forum, very simple idea, invited researchers to come along and share their work, but put a caveat on it that you were only allowed to present, and you know, the carrot, and therefore get access to people who might go into your trials. You can't come and present unless you agree to have a peer review session with a consumer, and they must say that your presentation is going to be interesting to them, they can understand it, and people will actually care. So if you didn't pass those 3 tests in a meeting with a consumer, you weren't allowed to come along. And we had 26 presenters and set up these partnerships with consumers, with researchers, and many of which are still ongoing. So I, facilitated these meetings, and we said we'll only be half an hour, probably less, and I'll keep people on task. And don't worry, these consumers won't take your time with telling all of their personal stories to you. And it turned out I left all the meetings at half an hour and left them to it. And this community forum that we had has kicked things off, and where it was taking 2 years to get people engaged in, there was one study that took 2 years to find 19 people to come and sit around all day and have their physical activity levels measured, into 620 something people we've got today actively involved in research, just because, and I guess the pivotal thing about the culture change has been that we've changed the power imbalance that existed by making ourselves more available and asking for direction. So it's been about power.
Absolutely. Can I ask you one more question now that we're talking about power? I know that you're a great advocate yourself for visibility, and you've been very open about some personal challenges that you have. Can you share some aspects of the condition that you are very vociferous and you're a great advocate for? So you're navigating the health system in 2 different hats, as a provider and as a patient. And how's that journey going?
Yeah, it's interesting. I guess I started being more open about the fact that I live with 2 major chronic health conditions and a range of other comorbidities, which I hope doesn't mean that I'm dying soon. I was very aware of lots of things going on in your very impactful presentation. But so I have Ehlers-Danlos syndrome, which is a genetic connective tissue disorder, which affects all of the connective tissue in my body. So it's actually a multi-system issue rather than just a joint flexibility issue. And also an unrelated autoimmune peripheral neuropathy, which is a bit of an inconvenience. And then there's a whole host of other things going on. But I spent most of my career trying to pretend as hard and as vigorously as I could that there was absolutely nothing wrong. Because my experience with having lots of health appointments came from just some injuries to start with. And it's almost just a bit sexy to have a sporting injury. I've got a broken collarbone and then got osteomyelitis from a surgery. It's interesting to talk about, and work is very understanding, and take as much time as you need. And once I got a melanoma, and that was very exciting because people care about cancer, which they should. But these garden variety things that will never go away, like if you're open about the challenges that you face and accommodations that you actually rightly deserve, so that you can be engaged in workforce and in life, in an equitable way. That's just, every example of it that I'd seen was really career limiting, and it worries people, and we don't yet have any sort of workforce or even societal understanding that disability is not a negative thing. It's a normal variant of life. Like nearly 20% of Australians are disabled in some way or chronically ill, depending on how you use a definition. But we absolutely should be providing really reasonable and achievable accommodations, because otherwise, if for no other reason, people who have been invested in for years who acquire disabilities are just lost. That potential's lost. And we're amazing problem solvers. Like the capacitive touchscreen platform on all your smartphones was designed by a disabled person to manage RSI. You know, there's lots that can be harnessed, and I think we need to start valuing people with all sorts of different medical conditions who are great problem solvers. I think I've gone off on about 3 different tangents now.
Well, I think you've made a very relevant point that brings back to our theme of discussion, that is about intersectionality. In your journey, you're becoming a champion of intersectionality. That we as individuals, clinicians, researchers, so on and so forth, are also vulnerable. And sometimes vulnerability is taken as a negative characteristic trait. We've got to embrace that vulnerability.
You've just reminded me what the question was, though. So the whole reason about being open about this, and even on Twitter, which was terrifying, was because like, when I was young, first diagnosed with these things, then there was absolutely no role models. And I was told very clearly by lots of people, like in healthcare and elsewhere, that I was not going to be successful, it wouldn't be possible. And then when you experience daily discrimination, and that might be microaggressions, and I mean, I think everybody here experiences these microaggressions, which is just a pervasive devaluing of you because of whatever your difference is. When you're experiencing that all the time, you just start to feel like you don't have value to bring, and that's limiting and unfair, and yeah, we need to do better. So I wanted to be open about that so that other people, and I mean, a friend of mine, Carly Findlay, who's an appearance activist, lives with ichthyosis and experiences huge amounts of discrimination every day, was one of the first people that sort of got me thinking, I just need to talk about this because it's normal. It's not fun, but it's just a normal part of life.
One of the fundamental aspects of partnership is leadership. And leadership starts with accepting the vulnerabilities we have. If we are cognizant of the fact that we are like everybody else, that the change that you're bringing is phenomenal. So allow me to congratulate you for what you're doing. Kathy, your story is really inspiring. Can you share your story with us? How it all started? Now you are heading the clinical genetics department at St. Vincent, and it could be really inspiring to many of my colleagues. Please, over to you.
Thank you, Sonu. I just want to start by saying thank you very much for providing this forum to share our experiences and journeys. And this opportunity, and thank you for the opportunity for me to participate. And it has made me reflect over the last few years on how I got to today. And it hasn't been a very easy journey. I was asked to introduce myself to, I was doing one of the leadership, workshops to introduce myself, and I found myself, started talking about that I'm a mother of 3, so I'm going to start with that. So I have 3 children. The youngest is a toddler, ranging from a toddler, the eldest being a teenager. And on top of that, I am also married to a very busy interventional cardiologist husband. So I've joked around that I feel like I'm a single parent sometimes because we just don't see each other, and I cannot rely on him on family responsibilities. Anyway, so with that, so that was about 3 years ago. I was in as you say, I came from nowhere. I was just in the right place at the right time. I was given the opportunity to help set up one of the few highly integrated clinical genomic centers in the Southern Hemisphere. And we basically started from scratch, from ground up. Nothing, there was no office space, we had to negotiate for that, there was no computers, we had to order everything from scratch. And not only that, it was in the context of the environment where it had never had a genetic service before. So for the last 100 years, in a tertiary hospital. So, like one of the speakers, I don't remember his name now, but one of the speakers this morning said disruption. So we started from disruption. With due respect, in a Catholic environment, trying to set up genetics, from nothing to trying to utilize the most cutting-edge technology, which is whole genome sequencing. So it wasn't a very easy task at all. So we, hopefully we are trying to transform from disruption. So that involved a lot of partnership building and relationship building, a lot of the debunking, dissolving of the myths of the technology, building trust, and also trying to manage unrealistic expectations. There was also a lot of hype about this technology as well. So trying to explain and education play a big part as well. Trying to educate at every level really about what this technology can bring, the utilities of it, but at the same time it may bring harm. It may also further widen the health equity gap. So there's a lot of work to do. So we, education and genomics cannot deliver on its own. It's whole genome sequencing is not the end of the story. We can identify lots of variants of uncertain significance, and we need research to back us up. We need education. Education at every level, not only the colleagues that we work with, but also patients, explaining about what this is about, so we can build trust, and also education, so it involved a lot of relationship building with at an individual level, interpersonal level, at an institutional level with research institutes, and also with universities, trying to promote genomics education. So it hasn't been easy, and we are still trying.
Life is never easy, and I applaud you for that, taking that step in the forward direction. One of the fundamentals that I gather from your story is that you're a risk taker. You believe taking that risk is fundamental to innovation, and that innovation will eventually bring positive outcomes to the patients and community. That is wonderful. That's the story I think many of the younger colleagues would like to take here. Thank you, Kathy. Rajesh, you are a champion of the South Pacific. You've brought so much of the great work that you do with the local communities, the Cal communities. You've been doing great work in India, across many countries. But before I go there, can you please share with your story from Africa and then to Australia, and that journey that you have navigated, and the story that comes out of it can be a lot of inspiration to many colleagues here.
Thank you, Sonu. Yes, so I grew up in South Africa. I experienced racism, discrimination, been thrown out of a few restaurants, told to get off a few buses. Then I guess went to India, had to, I guess, relearn my roots, because my parents are from there, and then came over here to Australia. And way of life was very similar to South Africa, Australia, but I had a lot of challenges. I always laugh. 18 years ago when I came here, my first job was working in customer service, and a common comment I would get was, "You speak English well," which, yeah. So, but yeah, I guess I always felt that Australia was a great place for innovation. I used to hear a lot in South Africa about what's happening in Australia. And coming from a dental background, I also never really felt that I wanted to be a full-on clinician. I always felt that I could do more with the community. And we know, basically, there's a common notion that the mouth is never seen as part of the body, although it is the center of all the infections. And so I was very passionate about trying to make oral health everyone's business. And I guess having some key mentors, as you said, believing in your idea, trying to, I guess, 10 years ago, getting an obstetrician or getting a midwife to start talking about oral health with a pregnant woman was very foreign. So getting people to believe in you and trying to negotiate partnerships with different disciplines was very challenging. And also being a migrant, that being seen as credible was an issue. And I guess I always laugh when people say, oh, you said you came from Israel and you start from scratch. But you still have a lot of experience from overseas, which is still valuable. Yes, you start from scratch, and that can help shape these partnerships. So I think having that, starting those partnerships, but having that mutual respect between professions, because working with different disciplines is very hard, and everyone has their own priorities. So I guess having those clear rules of engagement in terms of what your role is important.
Can I just touch base on that aspect? I think very important thing that you talked about, research and clinical practice is a collaborative endeavor. Each member of the team play a very important role. For patient to have an improved outcome, each of those processes need to deliver. Dentists, physical therapists, clinicians, scientists, etc., etc. Do you think that we have siloed ourselves in disciplines, within the disciplines, and whether those are the barriers also that we need to navigate as we build these platforms?
Yes, most definitely. I think in the area that I'm working in, I think there's always competing priorities from different disciplines, and I know my own profession has always been working in silos, but I think a key part of these partnerships is that trust and that mutual respect, but also transparency and accountability, and putting the needs of the consumers at the heart of the partnership, because priorities of stakeholders will change, but if you have mutual understanding and this is what the consumers want, then that helps in the decision-making process, because you'll always have conflicts and debates between stakeholders, and politics unfortunately does come into research.
That's so true. One other important part of your story is that you're giving back. You're actually grooming a next generation of PhD students, young researchers, clinicians. And I think that is also an important part of this story. The story that what we have, we would like to give back, to enable, engage, empower the next generation of inclusive leaders who can then become the torchbearers in their own right. Please share that story. That how do you think that is important in that chain of command? That do we have a responsibility to be inclusive, groom the next generation of leaders, let them give them sponsorship when we can. Not that they are not capable of. They all are fundamentally leaders. It's just that we can give an opportunity for them.
Yeah, most definitely. I think when you come from a diverse background and you often look at leadership and you may not see that diversity there, you think that it's going to be very hard to strive to that level. So you really need mentors to help you negotiate the system, and so I think I'm very keen to share my experiences, and I guess having gone through the mill and starting from scratch, I can relate to many of the international students and people who come and say, I know I have nothing here, but I was so and so there, and I say, well, no, that's not right. You do come with a lot of value, and so and also giving them that voice and that confidence to express themselves, even though you may have an accent, or you may not be in terms of proficient in English, doesn't mean that you are not competent, and so giving them that voice and giving that experience, and also getting them to lead the partnerships. So at an early stage, in their PhD journey or in their postdocs.
I see that on Twitter. You actually post very regularly about your PhD students giving talks. You make it a point to go and attend their talks. That is leadership. That leadership is inclusive, empowering, and transformations. Thank you for that. A big kudos for the work you do. Thank you, Ajesh. Anya, you have a very interesting background. You used to work at University of Sydney, and now you're at Western Sydney University. You have navigated challenges that comes from different challenges from your background, etc., etc. Coming to Sydney, what is the part of the story in you which has been motivational, which has been fundamental to your journey, which you think many of us can learn from?
first of all, thank you for inviting me, and I really loved your talk. I have to be honest here, the motivation for me has been my love of the ocean, the beach. That's what brought me to Australia, and that's what brought me to science. And you might think I kind of wandered into the wrong conference, because I'm actually a coral reef marine biologist who works in, it's a long story, but I'll try and make it brief. I also am half Russian, and I don't look Russian. I know I was born in Moscow, went to school there, lived through communism there, and then with my parents moved to Sudan. And I did my master's degree there in coral reef science, and decided that Australia was the place to be. There's a great barrier reef here. And so that's how I came here, and that was really my motivation. But subsequently, I found that it was rather hard to get funding to do coral stuff in those days. This was 91. And I forgot to mention I came here as a refugee, political refugee from Sudan. And so I started moving more and more into optics and bioimaging and now I run a control facility. So I guess to answer your question, which is, can you repeat that again?
No, I will just touch base on that. So research is a very multidisciplinary effort. And I'm reminded of a contemporary of Golgi and Kahal, Fritjof Nansen. So Fritjof Nansen was a Norwegian neurologist and he did a phenomenal work in the neuronal connections, and often is talked about he should have gotten the Nobel Prize before Kahal for his contributions to neurosciences. Fritjof Nansen was a Norwegian, but his background was he was a marine biologist. But the expertise that he brought from marine biology, that he actually translated into neuroscience and research, was game-changing. So I think we've got to accept that we need to have that cross-pollination of ideas from different disciplines if we really want to do some groundbreaking research. So that is also fundamental to that process. Do you think that is relevant in your field?
I think it's very relevant. And so I think what's important is you take your passion and you then you excite others to join that passion and then you find their passion. So for instance, my passion for coral reef research has led me to work in this Nobel Prize team, Roger Chien, fluorescent proteins. We developed, so I go out to the reef and I search novel types of green fluorescent proteins, and these are genetically encodable markers for biomedicine, cell biology. So I get to play underwater and I get to play in the lab where I work in cancer biology, in biomedicine. I also interact a lot with completely different disciplines. So for instance, we decided it is possible to use fluorescent proteins to improve organic solid cells. So I work with engineers in that and so forth. So I have lots of projects. But then I also, I'm really passionate about science and art because I think this is the kind of a new technology that is being recognized increasingly as being a really important area to break bottlenecks, to find new ways of thinking about things, finding solutions. And I've worked quite extensively now for 10 years with incredibly talented 3D immersive reality, virtual reality filmmaker. And we do so many things together. She's been, her name is Lynette Woolworth, and she uses my work from marine science, from biomedicine, and she's taken it to Davos, to Switzerland. We've traveled together to New York Science Festival. It's been shown in some 30 museums around the world and in pretty much, I think, 50 countries. And so it's one way to inspire people to really take on ideas. And what I find is for instance, at the World Economic Forum, is that the organizers, they were very worried when they first brought this up because they never did anything like that. And over there, it's CEOs, it's ministers, it's movers and shakers of the world. And so the organizers were a bit worried that we might not be successful. And they then taught us what to say to them. How do we convince people to listen about climate change or biomedicine and not use the time to do whatever they usually do? And we were very successful. And I found one way is that you, when people see imagery, visualization, particularly in three-dimensional space, immersive reality spaces, then they begin to feel. And then I would go on the stage and start hitting them with hard data and facts, and it really worked. So I would say that's what I'm passionate about.
So passion for multidisciplinary research and that expertise that you bring from the marine biology can be implemented and have that value for biological research. That's a phenomenal story. Thank you for sharing that story. Adiba, over to you now. Well, your story is quite interesting and inspiring as well. So you were in Monash before, and then you moved to Malaysia. People come from countries. Myself, we all came from different countries, and we came in. You obviously had a passion to go back and serve the community. How's that journey started? What was the inspiration behind that journey?
Thank you, Sonu. As you know, many people want to migrate to Australia, and I did the other way. I actually married an Australian and brought him back to Malaysia as well. So I often get asked, how come you came back to Malaysia? My answer is always, it was temporary insanity that's lasted longer than 20 years. But to be honest, it's the usual story of wanting to be with family, and I actually wanted, I want my children to grow up. At that time when I returned, I didn't have a family yet, but it was a conscious decision to at least in their formative years to know their roots, because my husband's half Malay as well. And because we said, with him being Australian, and at that time I had a PR as well, we could always come back if it didn't work out. But here we are, 22 years later. And I think what has made us stay is because, well, frankly, in Australia I would be a small fish in a big pond, whereas in Malaysia I'm a big fish in a small pond. I think every little thing, because there's so much that needs to be done in a country like Malaysia, and every little thing that you do has a much bigger ripple effect. And now when I sit across a desk and meet prospective returnees, particularly from the UK, lots of doctors train in the UK and then want to come back to Malaysia, and they go, oh, how was your experience? That's what I always tell them, don't be so idealistic, don't expect everything that you have, whether here in Australia or at the NHS, not that the NHS has a lot now. You'll have to give and take, and you have to be realistic, but every little change that you make has a huge impact, and that is very fulfilling.
Studying your work,
that's why I stayed.
looking at your work, and before this, you've got a lot of passion for doing work on improving those vulnerable communities, the prisoners and HIV patients, so on and so forth. What brings you to that motivation to really bring that research to these communities which are probably less studied and less supported in the community, especially in Malaysia, for example?
Yeah, I think my formative years in Australia, and I'm not just saying that because I'm here in Sydney, but I was still a medical student when HIV hit the news and was first recognized. And then when I trained as an infectious disease physician at Fairfield in Melbourne, I worked with really inspiring people, and the whole hospital was about giving and about recognizing diversity and about recognizing people for who they are, and it wasn't just the patients, it was also their partners and their parents and their mothers, and
I get very teary when I talk about this. And one story that I always relate in Malaysia, because you know, a lot of the religious leaders in Malaysia are quite judgmental.
Yes.
And I always relate the story of a transgender person from Brunei, actually, who was in the Fairfield Hospital, and I was her only friend as a doctor and you know, a fellow Asian. And she was dying at the time, and the only people who she had contact with was me and the imam from the nearby Preston Mosque. And I think that left a very deep impact on me. Yeah.
So there's an relentless passion to go back and serve the community, and second, you're very steadfast in recognizing what Australia has given to you. I think all of us are, all that love, you know, the gratitude to this country for giving us a platform for where we are today. On that note, I'm running short of time, and I just want to thank all of you, not for what you have spoken today, but for the leadership in your space of influence that you give. Please keep on that journey, keep empowering more people. And I hope all of your audience would have gathered some, you know, some anecdotes from these stories. And I wish you can share those stories in your community. So thank you very much for attending this session, and now I announce this session.